Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, this is Tom Viola with yet another Fast Facts Pharmacology Edition. In this edition, we're going to talk about medications that are sometimes used to treat asthma and COPD that really aren't treating asthma and COPD. What do you mean? I'm talking about miscellaneous respiratory agents, those things that patients can use that are over the counter that they sometimes think they can use to treat their asthma and COPD when they really shouldn't be. You know what I'm talking about, folks, self-medication. So for example, patients who have difficulty breathing may have seasonal allergies. That's true, but some people have allergies that cause inflammation in their lungs and therefore need a stronger medication, but try to rely on drugs like antihistamines, okay? So antihistamines are sold over the counter. They selectively block the histamine 1 receptors and they decrease allergic reaction, which is wonderful. Now, antihistamines can be broken up into different generations. You have first generation antihistamines that cause sedation, like Benadryl, and second generation antihistamines that are considered non-sedating, like Claritin and Zyrtec. Wonderful. Should they be used to treat asthma? No, unless they're used in conjunction with another medication in which the medical doctor has said you do need an antihistamine to block the allergenicity of whatever's causing the asthma, but you still need an asthma medication to treat the bronchoconstriction and the inflammation in the lungs. Well, what are antihistamines used for then if they're not used to treat asthma? Well, seasonal allergies, allergic reactions, sometimes even motion sickness, and even Benadryl is often used as an over-the-counter sleep aid. Okay, well, should I be concerned if my patient's using an antihistamine? Yes, because they can cause additive sedative effects with drugs like opioids, and in very high doses can cause arrhythmia. But because they're available over the counter, patients don't always need to tell you or don't want to tell you that they're taking them because they don't think they're medications. Another medication that's often used to treat both asthma and COPD would be an antitussive like dextromethorphan. Well, Robitussin DM is pretty popular, but should it be used to treat asthma? No. Asthma is an inflammatory condition of the lungs, whereas a cough can be due to inflammation in the lungs, but normally an antitussive is used to suppress the cough reflex. It works in the brain, not in the lungs, to make sure that your cough reflex is minimized. Well, antitussives like dextromethorphan, but also opioids like codeine and hydrocodone, have a drying effect on the mucosal surfaces of the lungs and in the mouth. They can cause drowsiness and sedation, but especially the opioids like codeine and hydrocodone and dextromethorphan can be addictive, so we're often cautious in using them in patients with a previous history of substance abuse. Finally, we've got the expectorants, like drugs like Robitussin, which are used to reduce the adhesiveness and the surface tension of that viscous buildup of mucus in the lungs. Well, should you use Robitussin to treat asthma? Well, no, unless the doctor has said we're going to use Robitussin in connection with or along with a drug that's used to treat asthma. Again, this is a drug that's used to help you break up mucus so that when you cough, you can expectorate or get that mucus out of your lungs. Again, should we be concerned about our patients self-medicating with expectorants? Yes, because while they're used for the symptomatic relief of a non-productive cough, if they're used for long periods of time, they may mask the symptoms of an underlying disorder like COPD or even perhaps tuberculosis. So this is Tom Viola with our final episode here of Respiratory Pharmacology in this Fast Facts Pharmacology Edition. Our next series of Fast Facts Pharmacology will be focused on yet another disease state. Until then, my friends, thank you so much for listening. Look forward to seeing you soon. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Facts.